Let's say you take an image and of the lateral lumbar spine, you get it back, it looks has a very low contrast, very gray throughout. Can you do anything to correct that without changing your technique? You got it. A lead mat behind the back. Exactly. That'll help clean up scatter. All right. If the patient spine is parallel to the tabletop or the image receptor, for the L5S1 joint space, where are we going to center, first of all? Okay.
Well, it'll be the space between the ASIS
If you think about where the C actually goes, it's you say that again, Tom?
space between the ASIS and the iliac crest.
Okay. Now I know I showed you guys all the C at the lab, but if you think about where that center ray is actually at, if this is up here on this part of my hand, we're on the crest, and you're between, and this was on my finger. Well, if my center ray is right there, it's got to be a little bit below the crest and a little bit posterior from the ASIS, correct? So the correct answer on that is about 1.5 inches inferior to the crest and about 2 inches distal from the ASIS. That's what you guys need to know for the test. What you do in real life is just do a little C.
So can you repeat what the question was?
Yes. Centering for the L5S1 lateral spot. You want to be 1.5 inches below the crest, 2 inches posterior from the ASIS. And again, I guess the point I was getting at earlier with that question, if the spine is parallel to the image receptor, would it be perpendicular, or would you put an angle on it according to the book?
5 degrees. No angle.
No angle according to the book. I always still put an angle on there myself. But according to the textbook, which is what you guys want to know for the test tomorrow, it should just be perpendicular. Now, let's say you've got a patient with very wide hips, and it's not parallel, then, Carlos, you angle?
5 degrees down.
Okay, 5 to 8 degrees cockeyed. All right, so what should be the center of our film on that? L5S1 joint space. All right. Okay. All of these views I've talked about so far, are there any special breathing instructions?
Expiration.
Suspend respiration, expiration.
Don't breathe, don't move.
Don't breathe, don't move. It'll be something on those lines. Okay. All right, let's talk about the special view for the lumbar spine, the apiaxial L5S1. We practiced this in the lab the last couple days. Most of you got a chance to practice it. First of all, how much angulation are we going to use on
30 for
30
men.
on these.
30 or 32, 35? Remember males, 30, females, you gotta aim a little more, 35 degrees. In which direction? I think you said it was cephalic. Alright, so for the apiaxial L5S1, 30 degrees cephalic for a man, 35 degrees cephalic for a female. And where should you center on
2
this?
inches above the pubic crest.
ASIS.
No, this one. You're going to be pretty much at the ASIS on this one. I think you're thinking of the sacrum possibly, or the SI joints possibly. On this one, for the L5S1, you're going to be centered right at the ASIS, midline. Okay. Let's say you do this view. This would be a situation type of question. Let's say you do this view and the joint space is not open like it should be. What do you think you've done wrong if you've got the patient positioned correctly.
You didn't angle enough?
Angulation, exactly, you didn't angle enough. If the joint space is not opened correctly, it's gonna be because you didn't angle enough. So to correct that, you would increase the angulation of your sensor ray. Okay, that's gonna cover the lumbar spine.